CCMA Medical Assistant Practice Test. Question 1. During a skills check, the scenario states that a tympanic temperature is ordered for an adult patient. Which technique is appropriate? Option A. Force the probe deeply into the ear canal. Option B. Use the probe without a cover to improve contact. Option C. Use the same technique for every age without adjustment. Option D. Position the ear canal according to device instructions before inserting the covered probe. The correct answer is option D. Position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 2. During a certification-style scenario, a patient scheduled for a procedure is involved when an adult patient has a respiratory rate of 18 breaths per minute at rest while communicating with the care team. How should this rate generally be interpreted? Option A. It is within the usual adult resting range. Option B. It proves the patient has asthma. Option C. It is always a medical emergency. Option D. It indicates apnea. The correct answer is option A. It is within the usual adult resting range. A resting adult respiratory rate of 18 per minute generally falls within the expected range. It does not indicate absence of breathing, does not automatically represent an emergency, and cannot diagnose asthma by itself. Question 3. During a skills check, the scenario states that a patient with shortness of breath is waiting to be evaluated for a patient scheduled for a procedure. Which position may help breathing while waiting? Option A. Fowler position with the head of the bed elevated. Option B. Lithotomy position with feet in stirrups. Option C. Prone position with the face down. Option D. Trendelenburg position with the head lowered. The correct answer is option A. Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 4. For a patient with limited mobility in an outpatient setting, gloves are removed after contact with a patient's wound dressing. Which action should follow? Option A. Touch the keyboard before cleaning hands. Option B. Reuse the gloves for the next patient. Option C. Wash hands only at the end of the shift. Option D. Perform hand hygiene immediately after glove removal. The correct answer is option D. Perform hand hygiene immediately after glove removal. Gloves can have tiny defects or contaminate hands during removal, so hand hygiene is required after removal. Reusing gloves, touching shared surfaces first, or delaying hand hygiene increases cross-contamination risk. Question 5. In a medical assistant certification review scenario, a patient offers an expensive gift in exchange for special treatment while supporting safe patient care. Which response is appropriate? Option A. Promise special access for more gifts. Option B. Accept the gift and move the patient ahead of others. Option C. Follow office policy and maintain professional boundaries. Option D. Post the gift online with patient details. The correct answer is option C. Follow office policy and maintain professional boundaries. Professional boundaries protect fairness, trust, and ethical care. Accepting gifts for special treatment, promising favors, or posting patient details creates ethical and privacy problems. Question 6. At a community health clinic, a patient is placed on contact precautions for a draining wound for a patient with hypertension. Which PPE is typically expected when entering for direct care? Option A. No PPE because drainage is covered. Option B. Sterile gloves instead of all other PPE. Option C. Gloves and gown as indicated by the isolation signage. Option D. Only a surgical mask for every interaction. The correct answer is option C. Gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 7. A medical assistant reviews a case where a patient has symptoms consistent with influenza. Which PPE is commonly used for close contact? Option A. Only sterile shoe covers. Option B. A surgical mask with standard precautions. Option C. A lead apron. Option D. No mask because influenza is not contagious. The correct answer is option B. A surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 8. During a skills check, the scenario states that an exam table is cleaned between patients after routine use after noticing a potential safety concern. Which term describes reducing many pathogens on a surface? Option A. Venipuncture. Option B. Apical measurement. Option C. Transcription. Option D. Disinfection. The correct answer is option D. Disinfection. Disinfection reduces many disease-causing organisms on surfaces and is appropriate for many non-critical items. Apical measurement, venipuncture, and transcription are unrelated clinical or administrative tasks. Question 9. At a provider-requested assessment, a container holds blood-contaminated disposable materials for an adult patient. Which label or container is appropriate? Option A. An unlabeled cardboard box. Option B. A plain office recycling bin. Option C. A food storage bag. Option D. A biohazard marked container according to facility policy. The correct answer is option D. A biohazard marked container according to facility policy. Blood-contaminated waste requires proper biohazard labeling and disposal to protect staff and waste handlers. Office recycling, food bags, and unlabeled boxes do not communicate exposure risk or meet safe handling expectations. Question 10. In a medical assistant certification review scenario, a regular EKG rhythm has 4 large boxes between our waves. Which approximate heart rate is calculated using the 300 method? Option A. 300 beats per minute. Option B. 120 beats per minute. Option C. 75 beats per minute. Option D. 40 beats per minute. The correct answer is option C. 75 beats per minute. For a regular rhythm, dividing 300 by the number of large boxes gives an estimate, so 300 divided by 4 equals 75. The other values do not match the 300 method for 4 large boxes. Question 11. In a medical assistant certification review scenario, a box of supplies must be lifted from the floor during the visit. Which technique helps prevent injury? Option A. Hold the box far away from the body. Option B. Bend at the knees and keep the load close to the body. Option C. Twist at the waist while lifting. Option D. Lock the knees and lift with the back. The correct answer is option B. Bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 12. After confirming the patient's identity, a small blood spill occurs on an exam room floor for a new patient. Which action should be included? Option A. Ask a visitor to wipe it up. Option B. Clean it with a dry tissue only. Option C. Cover it with paper and leave it for housekeeping tomorrow. Option D. Where appropriate PPE and disinfect according to bloodborne pathogen policy. The correct answer is option D. Where appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 13. A medical assistant reviews a case where an employee is assigned to duties with potential blood exposure. Which training is required by safety standards? Option A. Bloodborne pathogen training with exposure control procedures. Option B. Retail cashier training only. Option C. Real estate licensing training. Option D. Restaurant menu training. The correct answer is option A. Bloodborne pathogen training with exposure control procedures. Bloodborne pathogen training teaches exposure risks, protective practices, and post-exposure steps for healthcare workers. The other trainings do not address occupational exposure to blood or body fluids. Question 14. While following clinic policy, the medical assistant notes that multiple tubes including blood cultures are ordered during venipuncture after the patient asks a follow-up question. Which specimen is collected first in the standard order of draw? Option A. Red serum tube after all additives. Option B. Lavender EDTA tube. Option C. The blood cultures. Option D. Gray fluoride tube. The correct answer is option C, blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 15. After confirming the patient's identity, a patient has low hemoglobin and complains of fatigue for an adult patient. Which condition is being described? Option A, anemia. Option B, hypertension. Option C, dermatophyte infection. Option D, appendicitis. The correct answer is option A, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 16. At the front desk handoff, a chemistry test requires serum rather than whole blood. Which specimen type is needed? Option A, blood allowed to clot before serum is separated. Option B, blood mixed continuously with EDTA. Option C, a throat swab placed in urine preservative. Option D, a finger stick smear without clotting. The correct answer is option A, blood allowed to clot before serum is separated. Serum is the liquid portion obtained after blood clots and is separated from the clot. EDTA whole blood, incorrect swab handling, and an unprocessed finger stick smear do not provide serum. Question 17. A medical assistant reviews a case where venipuncture is being performed in the antecubital area while communicating with the care team. Which insertion technique is generally appropriate? Option A, insert through the vein and redirect repeatedly. Option B, insert bevel down at a 90-degree angle. Option C, insert parallel under the skin for several inches. Option D, insert the needle bevel up at about a 15 to 30-degree angle. The correct answer is option D, insert the needle bevel up at about a 15 to 30-degree angle. A bevel up 15 to 30-degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 18. In a medical assistant certification review scenario, a blood specimen arrives hemolyzed after collection for a new patient. Which practice helps prevent this problem? Option A, use excessive suction on fragile veins. Option B, force blood through a small needle into the tube. Option C, shake tubes vigorously to mix faster. Option D, gently invert tubes according to additive requirements. The correct answer is option D, gently invert tubes according to additive requirements. Gentle inversion mixes additives without damaging red blood cells. Vigorous shaking, excessive suction, and forcing blood through narrow equipment can rupture cells and cause hemolysis. Question 19. During a skills lab scenario, a new patient is involved when a patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best? Option A, tell the patient to skip water for the rest of the day. Option B, follow facility policy and notify the provider or lab before collecting if fasting is required. Option C, cancel all future appointments. Option D, collect and label it fasting anyway. The correct answer is option B, follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 20. A medical assistant reviews a case where a patient has swelling in the ankles from excess fluid in tissues while communicating with the care team. Which term applies? Option A, cyanosis. Option B, diplopia. Option C, edema. Option D, hematuria. The correct answer is option C, edema. Edema is swelling caused by fluid accumulation in tissues. Cyanosis, hematuria, and diplopia refer to bluish discoloration, blood in urine, and double vision. Question 21. A medical assistant reviews a case where a point-of-care test control result is outside the acceptable range for a returning patient. Which action should occur before testing patients? Option A, continue testing because controls are optional. Option B, throw away the control log. Option C, do not report patient results until the control problem is resolved. Option D, change patient results to match expectations. The correct answer is option C, do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 22. During a clinical skills check, a pediatric patient is involved when a urine specimen cannot be tested promptly. Which action preserves specimen quality according to policy? Option A, place it near a sunny window to keep warm. Option B, refrigerate or preserve it if testing is delayed beyond the allowed time. Option C, mix it with another patient's specimen. Option D, leave it uncapped at room temperature all day. The correct answer is option B. Refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 23. For a patient waiting for the provider in an outpatient setting, a finger stick specimen is being collected while prioritizing patient safety. Which step is commonly performed after puncture? Option A, touch the collection device to the skin surface repeatedly. Option B, wipe away the first drop of blood if required by the test procedure. Option C, squeeze the finger forcefully until tissue fluid appears. Option D, bandage before collecting the specimen. The correct answer is option B. Wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 24. While following clinic policy, the medical assistant notes that specimens need to be spun in a centrifuge for a patient asking for clarification. Which safety step is required? Option A, open the lid while the rotor is moving. Option B, spin a single tube alone for faster results. Option C, balance tubes of similar size and volume across from each other. Option D, place tubes at random angles. The correct answer is option C, balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 25. When preparing safe patient care, gloves are removed after contact with a patient's wound dressing. Which action should follow? Option A, reuse the gloves for the next patient. Option B, wash hands only at the end of the shift. Option C, touch the keyboard before cleaning hands. Option D, perform hand hygiene immediately after glove removal. The correct answer is option D, perform hand hygiene immediately after glove removal. Gloves can have tiny defects or contaminate hands during removal, so hand hygiene is required after removal. Reusing gloves, touching shared surfaces first, or delaying hand hygiene increases cross-contamination risk. Question 26. For an older adult in an outpatient setting, a labeled blood specimen is being sent to the laboratory during the visit. Which packaging is appropriate? Option A, put it loose in the regular mail bin. Option B, carry it open in a coat pocket. Option C, tape it to the outside of the requisition. Option D, place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. The correct answer is option D. Place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Biohazard transport bags help contain leaks and keep paperwork protected from contamination. Pockets, taped tubes, and loose mail bin transport create exposure and specimen handling risks. Question 27. During a skills lab scenario, a 12-lead EKG is being set up for a patient with hypertension. Where is lead V1 placed? Option A, 5th intercostal space at the left anterior axillary line. Option B, on the right wrist beside the limb lead. Option C, 4th intercostal space at the right sternal border. Option D, 2nd intercostal space at the left midclavicular line. The correct answer is option C, 4th intercostal space at the right sternal border. V1 is placed at the 4th intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 28. When preparing safe patient care, an EKG tracing shows irregular spikes while the patient talks and moves while supporting safe patient care. Which action should the medical assistant take? Option A, ignore the artifact and file the tracing. Option B, increase room noise so the patient relaxes. Option C, ask the patient to relax, remain still, and avoid talking during the recording. Option D, move electrodes randomly until spikes disappear. The correct answer is option C. Ask the patient to relax, remain still, and avoid talking during the recording. Movement and muscle activity can create artifact that interferes with interpretation. Noise, random lead movement, or ignoring the artifact does not correct the signal problem. Question 29. In a medical assistant certification review scenario, a clinic performs a rapid strep test classified as waived for a patient in the exam room. What does waived testing generally mean? Option A. Only a physician may read the result in every setting. Option B. The test never needs quality control. Option C. The result cannot be documented in the chart. Option D. The test is simple and has a low risk of erroneous results when performed correctly. The correct answer is option D. The test is simple and has a low risk of erroneous results when performed correctly. CLIA waived tests are considered simple with low risk when instructions are followed, but quality procedures still matter. Waived status does not remove documentation, training, or quality control responsibilities. Question 30. A medical assistant reviews a case where a patient reports new chest pain while an EKG is being recorded. Which action should the medical assistant take? Option A. Tell the patient to drive home and rest. Option B. Erase the tracing because pain changes results. Option C. Finish filing old charts before reporting. Option D. Notify the provider immediately according to emergency protocol. The correct answer is option D. Notify the provider immediately according to emergency protocol. New chest pain can represent an urgent cardiac concern and should be escalated immediately. Delaying, advising the patient to drive, or deleting clinical information can endanger the patient. Question 31. During a skills check, the scenario states that a provider asks whether a tracing has a basic sinus pattern after reviewing the order. Which feature supports that pattern? Option A. A missing QRS after every beat. Option B. Random spikes caused by loose leads. Option C. No relationship between atrial and ventricular activity. Option D. AP wave before each QRS complex with a consistent rhythm. The correct answer is option D. AP wave before each QRS complex with a consistent rhythm. Sinus rhythm generally includes AP wave before each QRS complex with consistent conduction. Missing QRS complexes, artifact spikes, or unrelated atrial and ventricular activity do not support a simple sinus pattern. Question 32. A provider asks for assistance because a patient is cold and shivering during an EKG for a patient with hypertension. Which artifact is most likely? Option A. A blood pressure cuff leak. Option B. Muscle artifact that makes the tracing appear noisy. Option C. A normal calibration mark only. Option D. A guaranteed myocardial infarction. The correct answer is option B. Muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark. Question 33. While training a new medical assistant, a returning patient is involved when a patient needs the chest exposed for electrode placement. Which action protects dignity? Option A. Ask unrelated staff to watch the setup. Option B. Discuss the patient's body in the hallway. Option C. Use draping and expose only the areas needed for electrode placement. Option D. Leave the door open for airflow. The correct answer is option C. Use draping and expose only the areas needed for electrode placement. Draping and limited exposure protect privacy while allowing accurate electrode placement. Open doors, unnecessary observers, and hallway comments violate dignity and confidentiality. Question 34. A provider asks for assistance because a 12-lead EKG requires limb electrodes while communicating with the care team. Which label belongs on the right arm area? Option A, LL. Option B, V4. Option C, RA. Option D, LA. The correct answer is option C, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 35. While following clinic policy, the medical assistant notes that an intramuscular injection is ordered in the deltoid site for a pediatric patient. Which action supports safety? Option A, identify the correct landmark and avoid injecting too low on the arm. Option B, inject directly into the elbow crease. Option C, choose the site through clothing. Option D, use the same site repeatedly without assessment. The correct answer is option A. Identify the correct landmark and avoid injecting too low on the arm. Correct landmarking helps place the medication in muscle and reduces risk of nerve or tissue injury. The elbow crease, injection through clothing, or repeated use without assessment are unsafe techniques. Question 36. For an adult patient in an outpatient setting, a tuberculin skin test is being administered. Which technique is appropriate? Option A, massage the site hard after injection. Option B, inject deeply into the gluteal muscle. Option C, insert the needle shallowly with the bevel up to create a small wheal. Option D, apply heat to spread the medication. The correct answer is option C. Insert the needle shallowly with the bevel up to create a small wheal. An intradermal test is placed just under the epidermis and should create a small wheal. Deep injection, massage, or heat can alter the test placement and interfere with reading. Question 37. Before documenting in the chart, a patient who appears anxious is involved when insulin is prescribed in units while communicating with the care team. Which equipment is appropriate for measuring it? Option A, a tuberculin syringe marked only in milliliters without conversion. Option B, a medicine cup for tablets. Option C, an insulin syringe calibrated in units. Option D, a household teaspoon. The correct answer is option C, an insulin syringe calibrated in units. Insulin syringes are specifically calibrated in units to match insulin dosing. Household spoons, unconverted milliliter markings, and tablet cups do not provide safe insulin measurement. Question 38. A medical assistant reviews a case where a patient asks why pulse may be checked before taking a beta blocker for a patient who appears anxious. Which explanation is accurate? Option A, they make pulse checks unnecessary. Option B, beta blockers can lower heart rate and blood pressure. Option C, they are used only as antibiotics. Option D, they always raise blood glucose immediately. The correct answer is option B, beta blockers can lower heart rate and blood pressure. Beta blockers commonly reduce heart rate and blood pressure, making pulse assessment clinically relevant. They are not antibiotics, do not always raise glucose immediately, and do not eliminate the need for monitoring. Question 39. While following clinic policy, the medical assistant notes that a patient uses a rescue inhaler during episodes of wheezing. Which process is commonly involved in asthma? Option A, loss of tooth enamel only. Option B, excess bone growth in the femur. Option C, failure of the eardrum to vibrate. Option D, bronchoconstriction and airway inflammation. The correct answer is option D, bronchoconstriction and airway inflammation. Asthma commonly involves narrowed inflamed airways that can cause wheezing and shortness of breath. Bone growth, eardrum movement, and tooth enamel loss do not explain asthma symptoms. Question 40. A medical assistant reviews a case where a patient develops hives, wheezing, and throat tightness after an injection after confirming office policy. Which emergency medication may be indicated by protocol? Option A, topical sunscreen. Option B, routine multivitamin. Option C, oral iron only. Option D, epinephrine. The correct answer is option D, epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 41. A provider asks for assistance because a handwritten order uses the abbreviation U for units for a patient scheduled for a procedure. Which action is safest? Option A, ignore the abbreviation and give any dose. Option B, change it to milligrams without asking. Option C, assume U means unlimited refills. Option D, clarify the order because you can be misread. The correct answer is option D, clarify the order because you can be misread. The abbreviation U can be mistaken for a zero or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 42. In a medical assistant certification review scenario, A patient asks whether to stop an antibiotic once symptoms improve. Which instruction is generally appropriate? Option A, stop immediately when feeling better every time. Option B, follow the prescribed course and contact the provider before stopping early. Option C, save the rest for a family member. Option D, double the next dose to finish faster. The correct answer is option B. Follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 43. After confirming the patient's identity, an order is for 500 mg and the available tablets are 250 mg each while prioritizing patient safety. How many tablets are needed? Option A, 2 tablets. Option B, 4 tablets. Option C, 0.5 tablet. Option D, 10 tablets. The correct answer is option A, 2 tablets. Dividing the ordered dose of 500 mg by 250 mg per tablet gives 2 tablets. The other amounts would provide too little or too much medication. Question 44. During a skills check, the scenario states that an EKG tracing has wandering baseline and one electrode is peeling away for a patient with diabetes. Which action is best? Option A, tell the patient the heart rhythm is definitely abnormal. Option B, write normal on the tracing without review. Option C, reattach or replace the loose electrode after preparing the skin. Option D, leave the electrode loose to avoid discomfort. The correct answer is option C, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 45. While following clinic policy, the medical assistant notes that a provider describes a patient's heart rate as bradycardic. What does this mean? Option A, high blood sugar. Option B, faster than normal heart rate. Option C, absent breathing. Option D, slower than normal heart rate. The correct answer is option D, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 46. A provider asks for assistance because a patient's blood glucose is described as hyperglycemic while prioritizing patient safety. What does the prefix hyper indicate? Option A, around the heart. Option B, without pain. Option C, below normal. Option D, high or excessive. The correct answer is option D, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 47. For a patient in the exam room in an outpatient setting, a chart lists hypertension as a chronic condition for a patient in the exam room. Which finding is associated with this diagnosis? Option A, inflamed tonsils. Option B, low body temperature. Option C, persistently elevated blood pressure. Option D, low blood oxygen only. The correct answer is option C, persistently elevated blood pressure. Hypertension refers to blood pressure that remains elevated over time. Oxygen saturation, tonsil inflammation, and temperature changes describe different clinical problems. Question 48. When preparing safe patient care, a patient uses a rescue inhaler during episodes of wheezing. Which process is commonly involved in asthma? Option A, bronchoconstriction and airway inflammation. Option B, loss of tooth enamel only. Option C, failure of the eardrum to vibrate. Option D, excess bone growth in the femur. The correct answer is option A, bronchoconstriction and airway inflammation. Asthma commonly involves narrowed inflamed airways that can cause wheezing and shortness of breath. Bone growth, eardrum movement, and tooth enamel loss do not explain asthma symptoms. Question 49. Before documenting in the chart, a small contained fire is being addressed with a fire extinguisher after alarm procedures while preventing documentation errors. What does the first step in PASS mean? Option A, push the patient. Option B, pour water first. Option C, prepare billing forms. Option D, pull the pin. The correct answer is option D, pull the pin. Pass stands for pull, aim, squeeze, and sweep when using an extinguisher. The other choices are unrelated to extinguisher operation and may delay a safe response. Question 50. A provider asks for assistance because a medical term ends in itis for a teen patient. What does the suffix usually mean? Option A, inflammation. Option B, visual examination. Option C, surgical removal. Option D, blood condition. The correct answer is option A, inflammation. Itis means inflammation, as in dermatitis or tonsillitis. Surgical removal, visual examination, and blood condition are usually represented by ectomy, scopy, and EMEA. Question 51. At a provider-requested assessment, a procedure name ends in ectomy. What does the suffix mean? Option A, inflammation. Option B, enlargement. Option C, paralysis. Option D, surgical removal. The correct answer is option D, surgical removal. Ectomy means surgical removal, such as appendectomy. Inflammation, paralysis, and enlargement use different suffixes. Question 52. When preparing safe patient care, the word gastroscopy contains gastro/o after noticing a potential safety concern. What body part is referenced? Option A, stomach. Option B, bladder. Option C, lung. Option D, nerve. The correct answer is option A, stomach. Gastro/o refers to the stomach and appears in terms involving gastric structures or procedures. Lung, nerve, and bladder use different combining forms. Question 53. A medical assistant reviews a case where a rash is described as proximal to the wrist for a patient with diabetes. What does proximal mean? Option A, farther from the trunk. Option B, closer to the trunk or point of attachment. Option C, on the back side only. Option D, toward the skin surface. The correct answer is option B, closer to the trunk or point of attachment. Proximal means closer to the trunk or the point where a limb attaches. Distal, posterior, and superficial refer to different anatomical directions. Question 54. After confirming the patient's identity, a patient with shortness of breath is waiting to be evaluated. Which position may help breathing while waiting? Option A, prone position with the face down. Option B, Fowler position with the head of the bed elevated. Option C, Trendelenburg position with the head lowered. Option D, lithotomy position with feet in stirrups. The correct answer is option B, Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 55. During a skills check, the scenario states that a patient reports burning during urination and urinary frequency during the visit. Which condition may be suspected? Option A, sprained ankle only. Option B, urinary tract infection. Option C, otitis externa. Option D, myopia. The correct answer is option B, urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 56. A provider asks for assistance because a patient has low hemoglobin and complains of fatigue for a patient with diabetes. Which condition is being described? Option A, anemia. Option B, hypertension. Option C, appendicitis. Option D, dermatophyte infection. The correct answer is option A, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 57. A medical assistant reviews a case where a staff member asks for a patient's full chart to answer a simple billing question. Which HIPAA principle applies? Option A, use only the minimum necessary information to complete the task. Option B, post the details in the waiting room. Option C, send the chart to a friend for advice. Option D, share the entire chart because staff are curious. The correct answer is option A, use only the minimum necessary information to complete the task. The minimum necessary standard limits access and disclosure to what is needed for the job task. Curiosity, public posting, or sharing outside the care team violates privacy expectations. Question 58. While training a new medical assistant, An insurance plan must approve a medication before it is dispensed during clinical workflow. What process is being requested? Option A, coinsurance posting. Option B, waive scheduling. Option C, prior authorization. Option D, alphabetic indexing. The correct answer is option C, prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 59. A medical assistant reviews a case where an adult patient is asked to rate pain during intake for a patient with limited mobility. Which documentation is most appropriate? Option A, pain level of 7 on a 0 to 10 scale with location and quality. Option B, patient probably exaggerates pain. Option C, no pain score needed because vital signs are normal. Option D, pain is bad because the patient looks uncomfortable. The correct answer is option A, pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report. Question 60. For a teen patient in an outpatient setting, an insurance plan states the patient must pay a set amount before coverage begins. Which term applies? Option A, consent form. Option B, copayment. Option C, contraindication. Option D, deductible. The correct answer is option D, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 61. During a skills check, the scenario states that a claim needs a code for the patient's diagnosis after the patient asks a follow-up question. Which code set is used? Option A, ICD-10-CM. Option B, HCPCS Level 2 only. Option C, NDC only. Option D, CPT only. The correct answer is option A, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 62. After confirming the patient's identity, a claim includes durable medical equipment supplied to a patient for a pediatric patient. Which code set may be used? Option A, only the patient's zip code. Option B, a pain rating scale. Option C, the provider's lunch schedule. Option D, HCPCS Level 2. The correct answer is option D, HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 63. In a medical assistant certification review scenario, a provider marks diagnoses and services after the visit for billing. Which document is often used? Option A, suture package. Option B, electrode tab. Option C, autoclave pouch. Option D, superbill or encounter form. The correct answer is option D, superbill or encounter form. A superbill or encounter form captures visit services and diagnoses for billing workflow. Sterilization pouches, suture packages, and electrode tabs are clinical supplies rather than billing documents. Question 64. During a geriatric visit, a pelvic exam is being prepared before the patient leaves the clinic. Which action supports patient comfort and privacy? Option A, leave the patient uncovered until the provider arrives. Option B, discuss private details loudly outside the room. Option C, invite unrelated staff to observe. Option D, provide appropriate draping and explain each step within the assistant's role. The correct answer is option D, provide appropriate draping and explain each step within the assistant's role. Draping and respectful explanations protect dignity and reduce anxiety. Unnecessary exposure, unrelated observers, and loud discussion violate privacy. Question 65. A medical assistant reviews a case where paper charts are filed alphabetically for a pediatric patient. Which name is usually used first? Option A, patient's last name. Option B, street number only. Option C, appointment room number. Option D, favorite color. The correct answer is option A, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 66. When preparing safe patient care, several patients are scheduled at the beginning of the hour and seen in order of arrival or need. Which system is this? Option A, wave scheduling. Option B, double entry bookkeeping. Option C, sterilization cycle. Option D, pulse deficit scheduling. The correct answer is option A, wave scheduling. Wave scheduling brings multiple patients in during a time block to manage provider flow. Bookkeeping, sterilization, and pulse comparison are unrelated concepts. Question 67. While following clinic policy, the medical assistant notes that a patient misses a scheduled appointment without canceling after reviewing the order. Which action is appropriate? Option A, bill any random amount without policy. Option B, discuss the patient publicly in the waiting room. Option C, document the no-show and follow office policy for follow-up. Option D, delete the appointment from the record. The correct answer is option C, document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 68. A medical assistant reviews a case where a patient requests correction of information in the medical record for an older adult. Which action is appropriate? Option A, change another patient's chart instead. Option B, follow the facility process for an amendment or addendum. Option C, erase the original entry without documentation. Option D, tell the patient records can never be reviewed. The correct answer is option B, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 69. A provider asks for assistance because a patient brings several prescription bottles to a visit. What is the purpose of medication reconciliation? Option A, record only medications purchased at the clinic. Option B, compare all current medications to identify omissions, duplications, or interactions. Option C, replace the provider's medication review. Option D, throw away medications that look old without asking. The correct answer is option B, compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 70. When preparing safe patient care, a patient has questions about risks before a minor procedure while supporting safe patient care. Who should answer clinical risk questions for informed consent? Option A, the provider performing or ordering the procedure. Option B, the receptionist only. Option C, the medical assistant by guessing. Option D, a random patient in the lobby. The correct answer is option A, the provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 71. A medical assistant reviews a case where a procedure is performed after the patient clearly refuses touching for a patient in the exam room. Which legal concern may apply? Option A, capitation. Option B, defamation only. Option C, abandonment only. Option D, battery. The correct answer is option D, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 72. When preparing safe patient care, a clinic may be liable for an employee's actions within job duties. Which doctrine is described? Option A, respondeat superior. Option B, homeostasis. Option C, deductible carryover. Option D, informed refusal. The correct answer is option A, respondeat superior. Respondeat superior means an employer may be responsible for certain employee actions performed within the scope of employment. The other terms describe consent, insurance, or physiology rather than employer liability. Question 73. In an outpatient medical office, a new patient is involved when a patient has written instructions about future medical care if unable to speak after the patient asks a follow-up question. Which document is this? Option A, Advance Directive. Option B, Superbill. Option C, Daily Deposit Slip. Option D, Autoclave Indicator. The correct answer is option A, Advance Directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 74. Before the provider enters the room, a patient asks which organ produces insulin for a pediatric patient. Which organ should be identified? Option A, pancreas. Option B, thyroid cartilage. Option C, gallbladder. Option D, spleen. The correct answer is option A, pancreas. The pancreas contains cells that produce insulin for blood glucose regulation. The spleen, gallbladder, and thyroid cartilage do not produce insulin. Question 75. A medical assistant reviews a case where a patient is anxious about a procedure. Which behavior shows active listening? Option A, interrupt to finish the patient's sentences. Option B, maintain appropriate eye contact and summarize the patient's concern. Option C, look away and type unrelated notes. Option D, tell the patient anxiety is silly. The correct answer is option B, maintain appropriate eye contact and summarize the patient's concern. Active listening uses attention, reflection, and clarification to show the patient was heard. Interrupting, disengaging, or minimizing feelings can increase anxiety and reduce trust. Question 76. During a skills check, the scenario states that a patient says they are scared about a biopsy result while following standard precautions. Which response is therapeutic? Option A, I know for sure nothing is wrong. Option B, that sounds frightening, I can let the provider know you have concerns. Option C, everyone gets scared, so stop worrying. Option D, you should not ask questions. The correct answer is option B, that sounds frightening, I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 77. In a medical assistant certification review scenario, a medical assistant reports a patient concern to the provider using SPAR for a patient who appears anxious. What does the S represent? Option A, sterilization. Option B, situation. Option C, superbill. Option D, supine. The correct answer is option B, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 78. During a skills check, the scenario states that a child has injuries that raise reasonable suspicion of abuse. Which action is appropriate? Option A, follow mandatory reporting and office policy immediately. Option B, post pictures online to get opinions. Option C, ignore it because reporting is uncomfortable. Option D, ask the suspected abuser for permission to report. The correct answer is option A, follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 79. After confirming the patient's identity, an anatomy diagram divides the body into left and right portions after confirming office policy. Which plane is shown? Option A, frontal plane. Option B, transverse plane. Option C, sagittal plane. Option D, the oblique medication route. The correct answer is option C, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back, and oblique medication route is not an anatomical plane. Question 80. When preparing safe patient care, a clinic applies appointment policies fairly to all patients for a returning patient. Which ethical principle is reflected? Option A, justice. Option B, hemolysis. Option C, tachycardia. Option D, polyuria. The correct answer is option A, justice. Justice involves fairness and equitable treatment. Tachycardia, hemolysis, and polyuria are clinical terms rather than ethical principles. Question 81. During a routine office visit, a patient becomes angry about a long wait. Which response is best? Option A, argue loudly in front of other patients. Option B, mock the patient's concern. Option C, use a calm voice, acknowledge the frustration, and offer to check the status. Option D, threaten to cancel care immediately without policy. The correct answer is option C. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 82. After confirming the patient's identity, a patient feels faint after a blood draw after the patient asks a follow-up question. Which action is appropriate? Option A, leave the patient alone in the chair. Option B, give insulin without checking blood glucose. Option C, help the patient lie down safely and notify the provider as needed. Option D, tell the patient to run outside for air. The correct answer is option C. Help the patient lie down safely and notify the provider as needed. A faint patient should be protected from falling and assessed according to protocol. Running, leaving the patient alone, or giving unrelated medication can create harm. Question 83. In an outpatient medical office, an older adult is involved when a conscious diabetic patient is shaky and has a low glucose reading for an older adult. Which action is generally appropriate by protocol? Option A, give nothing and send the patient to drive home. Option B, provide a fast-acting carbohydrate if allowed by office policy. Option C, tell the patient to exercise vigorously. Option D, administer a random antibiotic. The correct answer is option B. Provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 84. After confirming the patient's identity, an AED is available for an unresponsive patient with no normal breathing. Which action is appropriate? Option A, ignore the AED because it gives instructions. Option B, place the pads over thick clothing. Option C, use the AED only after the clinic closes. Option D, turn on the AED and follow its prompts while continuing emergency response. The correct answer is option D. Turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 85. In an outpatient medical office, a patient scheduled for a procedure is involved when a patient twists an ankle in the parking lot while working under provider supervision. Which first aid concept may be used initially? Option A, heat, running, and deep massage immediately. Option B, rest, ice, compression, and elevation as appropriate. Option C, ignore swelling until next year. Option D, sterilize the ankle in an autoclave. The correct answer is option B. Rest, ice, compression, and elevation as appropriate. Initial sprain care often uses rest, ice, compression, and elevation to reduce swelling and protect the area. Heat, running, ignoring symptoms, or autoclaving are inappropriate. Question 86. When preparing safe patient care, a patient is pale, cool, clammy, and confused after an injury for a patient scheduled for a procedure. Which condition is a concern? Option A, shock. Option B, otitis externa. Option C, acne. Option D, myopia. The correct answer is option A, shock. Pale, cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 87. At a pediatric visit, an AED is available for an unresponsive patient with no normal breathing. Which action is appropriate? Option A, use the AED only after the clinic closes. Option B, ignore the AED because it gives instructions. Option C, turn on the AED and follow its prompts while continuing emergency response. Option D, place the pads over thick clothing. The correct answer is option C. turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 88. A medical assistant reviews a case where a disinfectant splashes into a staff member's eye while working under provider supervision. Which first response is appropriate? Option A, rub the eye hard to remove chemical. Option B, use hand sanitizer in the eye. Option C, cover it and wait until tomorrow. Option D, flush the eye with water or eye wash for the recommended time and report the exposure. The correct answer is option D. Flush the eye with water or eye wash for the recommended time and report the exposure. Chemical eye exposure requires immediate flushing and reporting according to the safety data sheet and facility policy. Rubbing, delaying, or adding sanitizer can worsen injury. Question 89. A provider asks for assistance because a patient pays a fixed amount at each office visit under the insurance plan for a patient with a routine complaint. Which term describes this payment? Option A, relative value unit. Option B, premium refund. Option C, deductible only. Option D, copayment. The correct answer is option D, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 90. While preparing the exam room, a dressing change is being performed on a draining wound. Which action is appropriate? Option A, reuse old tape to save supplies. Option B, document the wound before assessing it. Option C, place soiled dressings on the clean supply tray. Option D, use clean or sterile technique as ordered and dispose of soiled dressings properly. The correct answer is option D. Use clean or sterile technique as ordered and dispose of soiled dressings properly. Dressing changes require technique appropriate to the order and safe disposal of contaminated materials. Placing soiled items with clean supplies, reusing tape, or documenting before assessment can create infection and accuracy problems. Question 91. While training a new medical assistant, a Snellen chart is used during screening during the visit. Which function is being assessed? Option A, blood clotting time. Option B, distance visual acuity. Option C, blood glucose average. Option D, hearing threshold. The correct answer is option B, distance visual acuity. A Snellen chart screens how clearly a patient sees at a distance. Hearing, coagulation, and glucose control require different tests. Question 92. While reviewing office protocol, a patient performs a pulmonary function test for a pediatric patient. Which instruction helps obtain a useful result? Option A, stop as soon as mild effort begins. Option B, seal lips around the mouthpiece and follow coaching for a full effort. Option C, breathe around the mouthpiece. Option D, chew gum during the test. The correct answer is option B, seal lips around the mouthpiece and follow coaching for a full effort. Spirometry requires a tight seal and strong coached effort for reliable measurements. Leaking air, early stopping, or chewing interferes with test accuracy. Question 93. In a medical assistant certification review scenario, ear irrigation is ordered for cerumen removal. Which precaution is important? Option A, verify the order and screen for contraindications such as ear pain or perforation history. Option B, aim forcefully at the eardrum. Option C, proceed even if the patient reports severe ear pain. Option D, use very hot water to dissolve wax quickly. The correct answer is option A. Verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 94. In a medical assistant certification review scenario, a vein tends to roll during palpation during a quality control check. Which action can improve venipuncture control? Option A, use the thumb above the puncture site. Option B, ask the patient to pump the fist throughout the draw. Option C, tap the needle against the vein repeatedly. Option D, anchor the vein by pulling the skin taut below the site. The correct answer is option D, anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 95. While training a new medical assistant, a new patient is involved when a patient asks detailed questions about a new diagnosis for a new patient. Which action is appropriate for the medical assistant? Option A, change the diagnosis in the chart. Option B, create a personal treatment plan without provider input. Option C, tell the patient not to research anything. Option D, provide approved educational materials and refer diagnosis questions to the provider. The correct answer is option D, provide approved educational materials and refer diagnosis questions to the provider. Medical assistants can reinforce approved education but should refer diagnosis and treatment decisions to the provider. Independent treatment planning, discouraging questions, or changing diagnoses exceeds the role. Question 96. During a routine office visit, a warm compress is ordered for a localized muscle strain. Which action supports safety? Option A, check temperature and skin condition before and during application. Option B, use heat over numb skin without monitoring. Option C, place it over a medication patch. Option D, apply maximum heat to speed healing. The correct answer is option A, check temperature and skin condition before and during application. Heat therapy requires temperature checks and skin monitoring to prevent burns. Excessive heat, numb skin without monitoring, or use over patches can cause injury or alter medication absorption. Question 97. In a medical assistant certification review scenario, a patient has been rushing and sits down for a routine blood pressure measurement while checking the chart. Which step should occur before recording the value? Option A, allow the patient to sit quietly with the arm supported at heart level. Option B, ask the patient to stand for the first reading. Option C, place the arm above the head to relax the vessels. Option D, record the value immediately to avoid delay. The correct answer is option A, allow the patient to sit quietly with the arm supported at heart level. Resting quietly with the arm supported at heart level reduces temporary changes caused by activity and position. Standing unnecessarily, elevating the arm above the head, or recording immediately after exertion can make the reading unreliable. Question 98. After confirming the patient's identity, the medical assistant needs to measure respirations after taking a pulse for a returning patient. Which technique is most appropriate? Option A, tell the patient to breathe faster while counting. Option B, continue holding the wrist and count respirations without alerting the patient. Option C, count only one breath and multiply by 60. Option D, ask the patient to hold their breath between counts. The correct answer is option B, continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 99. In a medical assistant certification review scenario, a patient has symptoms consistent with influenza. Which PPE is commonly used for close contact? Option A, only sterile shoe covers. Option B, no mask because influenza is not contagious. Option C, a surgical mask with standard precautions. Option D, a lead apron. The correct answer is option C, a surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 100. At a pediatric visit, a patient with a routine complaint is involved when an infant arrives for a well-child visit while supporting safe patient care. Which measurement is commonly documented in addition to weight and length? Option A, Snellen distance score. Option B, waist to hip ratio. Option C, head circumference. Option D, peak flow only. The correct answer is option C, head circumference. Head circumference is an important growth measurement for infants and helps monitor development over time. Waist ratios, peak flow values, and Snellen scores are not routine substitutes for infant growth tracking.